Unit 9 Test Questions 2. 59. A client is diagnosed with type 1 diabetes mellitus. The nurse understands that which of the following factors is not believed into cause of the beta cell distribution that accompanies this disorder. 1. Genetic factor. 2. Autoimmune factor. 3. Primary failure of glucogen secretion. 4. Viruses. The correct answer is 3. Primary failure of glucogen secretion. 60. An emergency room nurse is reviewing the laboratory results of a client suspected of having diabetic ketoacidosis. Which of the following laboratory results would the nurse expect to note in this disorder? 1. Absent ketones in the urine. 2. Blood glucose level of 500 mg per dl. 3. Venous blood pH of 8. 4. Serum bicarbonate of 22 milliequivalent per liter. The correct answer is 2. Blood glucose level of 500 mg per dl. 61. A nurse has provided instruction to a client who is newly diagnosed with diabetes mellitus and who will be taking insulin about measuring blood glucose levels. The nurse determines that the cell understands the procedure of checking blood glucose level when the client states to do which of the following? 1. I should check my blood glucose level every day at 5 p.m. 2. I should check my blood glucose level before each meal at bedtime. 3. I should check my blood glucose level 2 hours after each meal. 4. I should check my blood glucose level 1 hour after each meal. The correct answer is 2. I should check my blood glucose level before each meal at bedtime. 62. A client with aldosterone is being treated with spironolactone. Which of the following indicates to the nurse that medication is effective? 1. A decrease in blood pressure. 2. A decrease in sodium excretion. 3. A decrease in plasma potassium. 4. A decrease in body metabolism. The correct answer is 1. A decrease in blood pressure. 63. A nurse is providing instruction regarding home care measures to a client with diabetes mellitus and instruct the client about the causes the hypoglycemia. The nurse determines that the client need additional instruction if the client states that which of the following is a cause of hypoglycemia. 1. Increased intensity of activity. 2. Inadequate amount of fluid intake. 3. Vomited meals. 4. Decreased daily insulin dosage. The correct answer is 4. Decreased daily insulin dosage. 64. A nurse is providing dietary instruction to a client who is newly diagnosed with diabetic mellitus and who will be taking insulin about measures to control the diabetes. The nurse instructs the client that it is best to 1. Eat meal at about the same time each day. 2. Adjust meal time depending on the blood glucose level. 3. Avoid being concerned about the time of meal as long as snacks are taken on time. 4. Very meal time is insulin is not administered at the same time every day. The correct answer is 1. Eat meals at about the same time each day. 65. A nurse is caring for a post-operative adrenectomy client. The nurse monitors the client for which of the following? 1. Signs and symptoms of hypoglycemia. 2. Peripheral edema. 3. Signs and symptoms of hypovolemia. 4. Bilateral exophthalmos. The correct answer is 3. Signs and symptoms of hypovolemia.